My name is Michelle Carlson. I'm a hand surgeon at Hospital for Special Surgery in New York. I've been in practice for more than 30 years. I did medical school at Cornell and residency and fellowship at HSS. So I've been within a couple block radius for quite a long time. The ASSH has grown dramatically in the past 30 years. Just in terms of what we offer at the annual meeting is just amazing, with the number of papers and the instructional courses and the symposiums that we offer. It's become quite a different experience than it used to be. In terms of the composition of the ASSH, when I started in residency, I was the 7th woman to ever train at special surgery. And 3 of the 4 years I was in residency, I was the only woman in the program. We had 8 residents a year. Some programs, when I applied, didn't think women should be in orthopedics. So now our program is often 50-50. 2 years ago, our fellowship class of 4 fellows were all women. So just the composition, as you look out on the faces in the meeting, has changed dramatically. So much like, orthopedics started as general orthopedics, and if you became an orthopedist, you did everything in orthopedics. And then all of a sudden, people became fellowship trained, and they started being just hand surgeons, or just sports surgeons, or just back surgeons. And the same has sort of evolved in hand surgery. Now, a lot of times, especially at academic centers, you don't just do hand surgery, you really have your specialty within hand surgery. And so when I started in practice, I really started with an interest in pediatric hand surgery, and spent time focusing on treating, for instance, children with cerebral palsy, and doing research on treating those children. And I've been in practice for 30+ years, and at some point in the middle, I started to shift my focus, and all of a sudden really became more interested in sports-related hand surgery. And now I would say the majority of my practice is sports-related injuries, and I don't treat pediatric cases as much. And I think it's an interesting point that your practice can evolve also. You don't have to stick to one part of hand surgery. I mean, I think the important thing about that is don't feel like you can't make a change in your practice. My fellows will come to me now and go, "Oh, I didn't even know you did pediatrics before." And that's fine. You can, if you have a change in interest, that's fine in any way that you want to change your life. It's a long career, and you may find your interest change, and you just should pursue those. I mean, from a technical perspective, when I was a medical student, arthroscopy was putting a straw into someone's knee with an ocular on it and looking in like this. That was the beginnings of arthroscopy. And that evolved to when I was a resident, the actual arthroscopy equipment, and even when we started wrist arthroscopy, I think we used a shoulder scope. It was huge. So the ability to do arthroscopy has really changed hand surgery, and what we can do arthroscopically now that used to have to be open, and what we actually see better now arthroscopically than we did. The internal fixation techniques that we have changed hand surgery. When I started, we were doing X-fixes on everything and maybe pins and a couple of screws, and now the technical abilities of all those internal fixation techniques that we have changed our ability to fix fractures, which all translates into how well we get people back into returning to normal, returning to what they want to do. It's hard for me to even predict what the future of hand surgery is. As I reflect back on where we were when I started, what we do is so different than it was back then. Even being able to look something up, we used to have to go do a library search. If you wanted to say, like, how do you treat PT joint arthritis? You'd have to go to the library, tell the librarian, could you pull these papers for me? And then come back the next day and they'd pull papers, and now you just Google it. You don't even have to do a PubMed search. There's so much that's so much easier to do now. I think the biggest thing is you can't anticipate where it's going to be in 30 years. I think we've become much more involved in the business of hand surgery. We were a little bit white tower and sort of not aware of how that happened, and just did our hand surgery and assumed everything else would fall in place. And now people are much more involved in ambulatory surgery centers and, other income producers like, splints and ancillaries. That's a big difference than it was from 30 years ago, and I think will go forward be a big difference. The advent of virtual medicine has been, I think, fabulous for patients and for us. There's so many things patients come in for. They'll drive an hour to see me, and all I have to do is a 5-minute exam to make sure they're doing well. And they go like, that's it? I came all the way here for that. And so now they can do that virtually. And you can, if you think they need another test, you can have them do that before they come in. And so it's much more efficient. And I think the spread of virtual, I think we'll become better and better at virtual treatment and require in-person treatment a lot less. Obviously, surgery will still be in person, but I think the spread of the virtual treatment will allow us to treat so many more people that might not have sought treatment before. What I usually advise my fellows when they're choosing a job is to choose the place where you think you're going to be happiest. And sometimes they'll say, well, I want this job's the sort of job I want, but it's not where I want to be, and it's not where my spouse wants to be, and we don't have family. It's not really where we want to be. And I think, and this other job is a good job, but I'm not getting to really focus on the things that I want. And I think sometimes you can make the job, you can tailor the job to be eventually over time to be what you want to be. And so being happy in all other parts of your life as well as in your job is very important. And if you're not happy in those other parts of your life, I don't think you'll be successful in your job.